Hey everybody, Phil Gorman here, posture expert. Today I'm here talking with my friend and founder of the Acuball and Acuback, Dr. Michael Cohen. And today we're actually going to talk a little bit about sitting. So we currently have an epidemic of people sitting with poor posture. And did you know that sitting is now up there with obesity and what else? Smoking as the top 3 leading causes of some of the most terrible metabolic disorders that we currently see, i.e. certain kinds of cancers, type 2 diabetes, and heart disease. We all know people who are suffering from these things. So Michael, can you speak to the effects of sitting and what you've seen in your practice and how the Acuball and the Acuback is trying to support these people in living a healthier lifestyle?
Yes, certainly. The big problem is the forward slump.
Right.
We are so into our work, our mind completely tunes out of our body, and we get absorbed by what's on the screen. And especially if we're under stress or under time deadlines, we completely throw our body to the curb, and we do this.
Yes.
And so our muscle system, our organ systems become compressed. Our blood flow changes, our respiration changes. Everything goes bad. We're not designed that way. We're designed for motion, as we all know. So the Acuback was designed really to recreate the curvature in the lumbar spine.
Right.
And once that curvature is reconstituted in the spine, the thoracic and cervical will realign basically on their own. And that was the original idea, and what we saw when we started to get it out there into the public domain was that people were using it for a whole variety of reasons, and what we realized we'd done wrong was that it wasn't enough to tell a person to support your low back. You really have to move it throughout your spine, because any one specific spot over time, your body will fatigue and it won't be comfortable.
So it's the change.
Change, motion, it's all about motion. So that was the idea, was to give people support, and what we grew from was the knowledge that what you really need is to give people a tool that helps them stay in motion, even when they're sitting. None of that replaces the need to get up and walk around. And as you were saying to me earlier, I believe you said 20 minutes is the optimum?
Ideally, every 20 minutes, you should be changing positions. So says science.
Yeah. So you're going to have trouble motivating people to do exactly that, but what you can do is give them a tool and basic knowledge. And I always quote the landmark study that was in the American Journal of Epidemiology in 2012. It was Australian researchers, and they showed that people, even when they were avid exercisers, and this was a shock to most people. I was shocked when I read it. I read the study 20 times,
right,
because I couldn't believe it. Even when they were avid exercisers, if they were at a computer for 8 to 10 hours a day, they had a 200% increase in distal, which is the end of your colon cancer.
Wow.
And it was not a factor of exercise, completely ruled out. So we know that, and what they didn't understand is, why isn't it affecting the proximal colon? Why only the distal colon? Nobody knows the answer.
Right.
But one of the theories is that when your right arm is out in front in motion on the mouse, it's creating enough motion there for things to still be moving. Whereas your left arm is still, even though the fingers are moving, that freezes this area. And the death of the body is to not move. So the mousing may be the reason that it's not happening in that side, but it's definitely in the colon and rectal area as well. So I use that study to do 2 things. 1, educate, and 2, motivate. Because when I read that, right away I told all my patients, everybody has to know that.
Yeah.
And I saw it made changes.
Mm-hmm.
The other thing that I think is really important is for people to look down the road in their life and see what they feel like now, and see, okay, forecast, what am I going to feel like in 10 years from now, in 20 years from now? We are the guinea pig generation of computer users. No one's ever gone through a life cycle on a computer. I sincerely believe we'll look back on this time in history as the greatest single change to the human body that's ever occurred. Wow. We were hunter-gatherers for 200,000 years. Mm-hmm. It's only this last 10,000 that we're civilized,
sure,
so to speak, civilized. And staying still is only the last 25, 30. Even with a typewriter, you were still doing this.
Right. Yep.
You don't have to do it. And I'm sure you've seen patients like who just sit all day like that and then go home and sit and do that.
Correct.
So it is a crisis, and similar to smoking in the early 1800s that was prescribed by physicians
Yeah.
for hysteriosis.
Right.
I think we'll also look back on this as a time where we're not aware of the dangers of something that we have in our life every day.
Right.
But we've got to be smart, we've got to be motivated, and that's, I think, the purpose of what you're doing here is spreading that knowledge, which is a good thing.
Thanks for your insight, Michael. Dr. Michael Cohen, everybody. Thank you.